Hello, this is Dr. Do again. This video is on alphabetic list problems on letter P. Previously, I talked about the pancreatitis on previous video. And the other important, quite common, could be very serious condition come to my mind is the pneumonia. However, I think I have included pneumonia in the lung section under the letter L. So, and then there's another it's not disease, but it's an important a category for postmenopausal care. And this is another thing came to my mind. I think it's because it's the body change along this postmenopausal variety of changes from the heart, from the brain, and also the bone, and also the general well-being and function level. So I think it's worth to mention, and probably you already know it, but I just hope there's something I presented here or I shared here, you hope it will help. So let me just bring up the first emergency situation, any emergencies situation associated with this postmenopausal. Even though it's not emergency, but warrant to see your physician, the irregular bleeding, or after you a couple of years of postmenopausal still have some spotting or bleeding, that's definitely a sign to see a physician. If the bleeding is heavy, huge, and associated with abdominal pain or losing weight, definitely it's an urgent situation, even though it's not emergency. However, if the bleeding is huge amount, usually it's not. But just in case some malignant change invading the vessels that's caused heavy bleeding, if that's the case, life-threatening, go to the emergency. Or the postmenopausal, like previously I talked about the osteoporosis, I think on letter O category, postmenopausal, older elderly, lean body mass, and feel the pain on really deep to the bone, I think, because the risk of the fracture. If that's the case, go to the emergency. Other than that, I think it's just, even though it's malignant, even though it's serious, but if it's not life-threatening, I think just see your physician. And postmenopausal, of course, you manage every day for those group of populations at home. Follow either your medical advice or your own well-being and your own knowledge about yourself, and to take care of yourself. So this postmenopausal is really basically the major change caused all of those problems is the estrogen decrease from the ovary, cannot produce as much as estrogen as previously. So the decline of this estrogen has a great impact on the health. For example, it has been shown that female has a lower mortality rate in terms of cardiovascular or cerebral event. So this is because the estrogen has a protective effect on this. So when the postmenopausal estrogen decrease, the first I prioritize the risk is the heart and the brain. So talk about the heart. If you had the previously diagnosed coronary artery disease or hypertension and undergoing postmenopausal and in the older age, definitely I think need to follow up with your physicians, adjust your medications, and of course on top of that, if you're overweight, and the lifestyle modification is also very important. In terms of brain, I think estrogen, I do not see the studies, but sometimes female has different brain function in different way compared to the male. But during this postmenopausal, the decline of estrogen probably changed the way of thinking, the way of view, and also the mood, affected the mood. So if that's the case, definitely you need to talk to your primary care physician, discuss about this mood change, swinging along, decrease with this decline of estrogen. Usually it's kind of the mood kind of going downward. It's tend to be blue. So if that's the case, if necessary, take some supplement or prescription medication to keep the mental health. And in terms of other organs, in addition to the heart and the brain and bone, that's the other one. osteoporosis is one of the most common conditions for the postmenopausal woman, and because of this declined estrogen, the regulation of the osteoclast, the osteoblast cells, totally in a different way. Because I mentioned previously, estrogen can increase the activity of osteoblast, which means to generate the bone, and to inhibit the activity of the osteoclast cells, which is eating the bone. So I just use the common language. So with this decline of estrogen, then the bone strength definitely decreases. So follow up with your physicians, take the medication if diagnosed as osteoporosis. That's already quite straightforward. The other important, of course, risk factors for the malignancy, breast cancer, ovarian cancer, and also the uterus cancer. Some of them actually decrease the estrogen, decrease the risk. However, if there's a genetic cause like breast cancer, still, and if you're taking supplement of estrogen, definitely you need to monitor that closely. And talk about this malignancy and the regular exam, preventive exam, you need to follow with your physicians. And for example, the pap smear and before 65 years old, and the mammogram, definitely that's the important thing for the postmenopausal woman. And in terms of supplement of estrogen, I think there's some talk about the non-prescription way to supplement estrogen. There's some over-the-counter products you can get for that. Or in terms of food, I think some of the high-protein food like soybean and also the animal liver containing part of the estrogen might help. But for those who had the hyperlipidemia, hypertension, obesity, the liver probably, the animal liver probably is not a good resource. So probably if you're really interested to get supplement, then talk to your physician through the prescription medication or the other estrogen mimic product in the over-the-counter. And in terms of the general postmenopausal care, in addition to follow your preventive, to monitor regularly the osteoporosis or any other conditions, the mood, I think I already mentioned it, regulate the hormone estrogen decrease, leave the mood really tend to going down, particularly those isolated and sedative lifestyle. For those people, really need to watch out your mood and do not go too deep to the depression. That's another high population of depression is in postmenopausal women and in elderly male. But for the postmenopausal woman also had a risk. So if that's the case, what you can manage at home for yourself, looking for the activities, looking for the mental or spiritual support, or talk to your physician regularly if you think you have risk, if you think you have family history, or if you think you have previously swing the mood, even though when you were young. For those people, really need to address this to your physician, so then treat it in advance, at early stage or at a menopausal stage, not post, to start to supplement with some medication or treat it with some medication to maintain the mental health. So this is about the general postmenopausal care. It's quite straightforward, but just for those who had concerns at perimenopausal stage might get prepared, get ready for the change. So I'm going to stop here, and I hope it helps, and thank you for watching. I will see you next time.